This video documents how the COP-RCORP initiative approached the Prevention Core Activity 1, increasing access to naloxone. The majority of the video comes from our 5 local communities describing in their own words how they worked toward this goal as they presented their work on a regularly scheduled consortium meeting. The slides on the website are the slides presented by each county to tell the story of their work. Because COP-RCORP represents 5 localities brought together through braided funding with a research institute and a university, we are taking a multi-level approach to meeting the core activities of the implementation initiative. The 3-year award means that we are distributing work across time as well as consortium members, taking advantage of our partnerships when possible. As a consortium, we came together at the beginning of our award and decided that while some activities made sense to work on together, the 5 communities could independently work on increasing access to naloxone. Each community has experience working with naloxone and felt comfortable pursuing these activities on their own. As such, our members worked independently to develop, implement, and assess intervention models that leverage opioid overdose reversal and increase naloxone availability as a bridge to treat and ensure that rural communities have sufficient access to naloxone. In our February 2020 meeting, consortium leaders came together to share what they had accomplished relative to their naloxone goals. Our multi-level approach to the HRSA implementation initiative, where we work on some activities independently and some as a collaborative, can be compared to the social stages of play from developmental social psychology. The naloxone activity represents a solitary stage of work, whereas other activities will involve collaboration and be more associative or social in nature. From here, the recording begins, with Dr. Holly Raffel further describing this model of collaboration.
Good afternoon. Can everyone hear me okay? Just give a thumbs up. Perfect. I'm really excited to be here with all of you today. As we know, we are working at our collaboration status on several of our core activities, and we've been exploring sort of the social stages of play, and we know that we are looking at moving from sort of that onlooker play to parallel play into social play and associative play for those core activities where we've agreed that it makes sense for us to work together. Today, we're going to go over the progress that all of you are making on naloxone. Recall that naloxone was something where you all felt pretty confident. It's something you've been doing for a long time, and you've been doing essentially solitary play, been working on your own. Well, now is the time for us to kind of do some onlooker play and hear what others are doing. So we will start with Ashtabula County and hear about naloxone in their community.
So Holly, this is Miriam. Do you just want me to talk about what we've been doing and our basic philosophy that's on our slide?
That's perfect. Thank you. We're just kind of into hearing whatever you feel it's important for this group to hear in order to help them advance their work.
Okay. What we found out over time, having tried to do like organized events and distribute the naloxone by advertising, and we gave away tickets, and we did all kinds of fancy things to get people to come. But what we found over time was that we had the most success when we were meeting people where they were. So we would attend events such as our remote area medical, the RAM, and we could give away a lot of kits if we were going where people were already gathering for other reasons. So we did a lot of kits there. We did a lot of kits at our park conference. Our health department will set up at one of our agencies where we know there's going to be people and try to do it before treatment. So we also, with our quick response team, they now have naloxone, so they're able to offer that when they go out and meet people in their homes. We've done it with our drug court and tried to just when they're having, their alumni meetings, being able to offer that to them. The various community events, we still do a few events where people can come into the health department, but those don't seem to have as much success. And then also things like our overdose awareness walks, our family-driven groups. So we just kind of go where they're at, whether it's traditional or non-traditional groups, and then offer it to them. And sometimes we can do 30, 40 kits at a time when we go to some of these events because people are already coming, they're already there, and they're willing to talk about it and do the little mini training and take their kit with them. So.
Thank you, Miriam. Could you speak to a little bit about how you arrived at that sort of mantra, if you will, of meeting people where they are?
Well, when we first started working collaboratively with our health departments and the other partners, we would actually have an event and say, okay, we're going to have an event at an agency or at the health department or some other place where people are used to coming, and would advertise it in, on websites, in the newspaper, have flyers available. People would sign up and say they were coming, and then when we finally had it that day, some people would come, but not nearly as many people as signed up, and also not nearly as many people as we probably could have served. So, we'd have 25, 30 people sign up and maybe have 10 show up. And so after doing that a few times, we started brainstorming as to what's a better way? What's a better way that people would receive this? Because they wanted it, but how can we do it in a way that it's easier for them to do the training, to take the kit, to feel comfortable? Because we were concerned that maybe there was some stigma with coming together as a large group, or coming to the health department, or coming to an agency, or coming. So we were worried that there might be some stigma that was a barrier, as well as, again, we're the largest by square miles county in the state, and so we would move this so that we could maybe cater to the southern part of the county or the northern part of the county, but still, people still weren't coming, and so we decided maybe it was stigma, maybe it was not having that last little bit of motivation that you needed to come do this, because you were also admitting that you probably knew someone who was struggling with an addiction, and was that creating a lot of stigma for folks. So if we go where people are already at, they're able to float in and out of tables and other types of vendors that are giving away free things, and they're able to kind of just wander over. And sometimes we've even noticed that when they wander over to the table where we're giving away the Naloxone, they'll even bring a friend. It's kind of like phone a friend, bring a friend with you, and then both of them will get it. And being able to have it with quick response and at drug court, you can get it to those family members and those people that love individuals who are struggling with addiction, and it's in a venue where they're less stigmatized, they're more comfortable, they're able to easily take it. So it was trial and error, and then suddenly realizing that, if you offer it where people are already at, where they feel most comfortable, they're more likely to take the kit then.
Thank you, Miriam. So members of our COP-RCORP Master Consortium Learning Community, what questions do you have for Miriam and Bridget in Ashtabula?
Miriam, when you go to where people are, how do you do the training when you're giving out the kits? Because we thought about doing this too, but.
Yeah, so there, I think the health department has shortened the paperwork and the training. And say, for instance, with our quick response team, they also have the ability, they have it downloaded on their phones and their tablets and stuff, so if they want to show the video, they can just show the video right there. And it's much easier when you have the health department nurses involved, and they also train some of our treatment provider folks. Then they're able to also do the training verbally and kind of show them how to use the kit and kind of move them through that process within about 15 minutes or so. So the process ends up being shorter because the Department of Health has allowed it to be shorter, and we also have been able to use mobile electronics so that people can actually, if they want to watch the video about how to administer it, they can show it to them right where they're at.
Great, thank you.
Other questions for Ashtabula? Okay, thank you. So with that said, we'll move on to Tony and Patty in Fairfield County.
Okay, so this is Tony, and I'm going to talk a little bit about our naloxone. So keeping in mind that for us with this grant, we are targeting 5 zip code areas in our county, so it's not the whole county. And some of these, actually most of these zip code areas are very small communities. So we have done some of those community trainings like Miriam talked about with good success, and we've been able to distribute naloxone kits. We also work with our local hospital, Fairfield Medical Center. They do the Project Dawn, and they do trainings every quarter, although their trainings are 2 hours in length. So they're really long and not the kind of shortened, I mean, you really have to commit to an evening to go do the Project Dawn training. We also work with our quick response team, and they, like Miriam talked about, when they go out to a home, they make sure that family and or that person with substance use disorder has a Narcan kit. So we have explored some different types of events for our little villages that are in our zip code areas. The last one that we tried was we wanted to attend a basketball game at the local high school that would have encompassed 3 of our zip code areas. And we actually even had agencies willing to come in and do all kinds of, share all kinds of resources around treatment and recovery. And then we were going to give out naloxone kits and provide the training and also give out Datira bags. And so we worked on this event for a good month, and a week before the event, the principal decided that it would not be a good fit for the basketball game. So that gets into some of the discussion that we've had around stigma. So we are now working on some summer events. We have one of our communities that has a community care day. And so we are going to, again, try and have our consortium members be able to have display tables about recovery and treatment, and then also provide naloxone. So if you move to the next slide, you can see some of our data from 2019. Project Dawn by Fairfield Medical Center actually dispensed 538 kits in 2019, and in 2020 so far 14 kits. And then our quick response team gave kits out to MuniCorp Probation, Lancaster Police Department, Fairfield County Sheriff's Office, the Major Crime Unit, and then 15 kits to clients and family members. So the next slide is something that we did to try and have people know about Narcan and what it is and how it works, because people don't realize what it is. They are unsure of what it does and how it works. So we were lucky enough to get some funding from OMAS. And with that funding, we did some PSAs, and one of the PSAs was on Narcan. And so we have the PSAs on our websites. A lot of our consortium members or opiate task force members have it on their websites. We were also able to print brochures that we can hand out about Narcan and how it works and what it does. And our point agency for all of our PSAs would be our 211 agency. So they know that if somebody sees a PSA, that they may get a call about where to send them for a naloxone kit or where to send them to do drug disposal. So they're like our point. I just do want to say that the all four, so we did 4 PSAs, and all 4 of the people that did the PSAs are local folks. So Josh, that did the Narcan, is on our QRT team. And so he volunteered to do this PSA. We have someone in recovery that did a recovery PSA, someone that provides treatment, do our treatment PSA, and then we had a firefighter do our drug disposal PSA. So, and those are all on YouTube.
I'm sorry we couldn't make the audio work, but we will make sure right after this meeting that we share out the link so that you all can take a look at those PSAs.
Okay, great, thank you.
What questions do we have for Fairfield County about their approach for naloxone distribution?
Tony, this is Stacy. I was just wondering, you said that the PSA was funded through Ohio Moss. Was that through a grant? And then also how much was that to get produced?
So it was through a grant, and it was through the Collective Impact grant. So they had some funding at the end of the grant that you could write for. And so I'd have to look back because it was $60,000, but we did PSAs. We also did the brochures. We also did lock boxes for folks that are in recovery and Datira bags. So we did a lot with that $60,000. So I'd have to look back to see specifically how much the PSAs were. We have a local group here that does recordings that we were able to work with. So we also did a longer video about alternatives to pain medications.
Thank you.
Robin, I see you're unmuted. Did you have a question?
No.
Okay. I just wanted to make sure I wasn't leaving you out. Thank you. Any other questions for Fairfield County? Okay. If it's okay with everyone, we'll go ahead and move on to Sandusky.
Hello. First of all, I want to say I'm going to steal everybody's idea. And I appreciate you guys putting this opportunity out to see what the other communities are doing. Because sometimes we kind of think narrow. And I am getting a lot of good ideas. So our partners for our project is our Health Partners Group, which is our larger consortium. But most specifically, we're working with our EMS director, who's very active around our coalition table. So he is going to be working with one of our public health nurses, Laura, who's sitting right beside me. She's kind of new to these webinars. So he is going to be working with Laura, one of our public health nurses, to put together 4 community trainings. And we're not just limiting it to the community trainings, where we're also kind of thinking about different ideas if we would have people stop into the health department and ask for a project on kit. And then what would that look like? How would we put that together? We also have the Harm Reduction Ohio, that website that I just discovered not too long ago. So we can help promote that as well. We're using the toolkit that was produced by Ohio Department of Health, and I thought I had it on my desk, but I put it in my to-go bag. So they put together a pretty nice kit on how to do these trainings in your community. We are going to make sure that they're not just located in our central city, which is Fremont. I think our county is 40 miles from end to end. We're kind of long and skinny. So we want to make sure that we get it throughout the different communities and different times of day. We are purchasing our Project Dawn kits through Ohio Department of Health's pharmacy. I mean, I'm looking at Bethany. It's called something like their pharmacy services, something. She's sure not. She said sure. So we're getting our kits through there, and that's where we get our naloxone allocation that we provide to first responders. The marketing of our sessions, I'm again learning so many new ideas on here, but we thought about doing some radio PSAs, partnering with our partners to help spread the word through flyers and word of mouth, and some of our most specific, our recovery community and treatment community, to make sure that the word is out there that we have these to offer. Naloxone, our community kind of has a history of, we need to kind of baby step naloxone to be able to give it out to the general population. Initially, I want to say like 3-4 years ago, our Board of Health was very reluctant to put naloxone in the hands of the general public, but I think they have been able to digest this whole opiate issue and how it's affected our community. So I think they're a little bit more on board. You can go ahead and go to the next slide. And this is just a part, the next 2 slides are just a part of some of the wording that we put into our contract with our local EMS. It says what, the public health department will do. And then the next slide, you can go ahead and go to it. Nobody wants to read that, I'm sure. And this is what we're asking from our local EMS, just making sure that he is an active part around the table with our consortium and our meetings and discussions, which he has always been. And we really get a lot of good information back from, his name is Jeff Jackson. He's a pretty real guy, and it's kind of been very educational, I think, for us to see what he sees when he's out throughout the community dealing with an active overdose situation. So that's just part of the roles and responsibilities for his piece in the contract. Do you guys have anything to add? Okay. I love the PSA idea. We were whispering about that.
So Stacy, can you talk a little bit about how the negotiation went with the contract language with your EMS? Because you're very specific about what they need to do as part of being an RCORP implementation sub grantee, if you will.
Yeah, our contracts are something that we're trying to be a little bit more intentional about. We have some very, I don't want to say generic language, but all the contracty language that we use, but we've kind of started putting an attachment on the end, which is, we will do this, and we will be specific about asking them what to do. We've also kind of switched to some deliverable-based types of contracts, but this one, we're giving him $300 per training session, and we just kind of, I don't know how we really came up with the components of it, but we do know with number 4 that we need to get that information back from him, and Matt did help me with that wording just to kind of make sure that we were tying it back to performance measures, but really making sure that they're involved in those discussions, because I just don't want to, I guess, contract or have an MOU with somebody who is just so silent and they don't have that accountability, I guess.
Yeah, and I think from some of our other contracts from other grants that we've done in the past, we've given money out and really not gotten back what we wanted out of that contract. So I think this time around, we wanted to be a little more specific. So we were ensuring that they were going to hold up their end of the bargain here and do what they say they were going to do.
Great, thanks to all of you for adding in. What questions do we have for Stacy and the Sandusky County Consortium? Hearing nothing, let's go ahead and move on to Seneca County.
Good afternoon, everyone. Nicole apologizes that she could not participate today. She's actually in Columbus for Advocacy Day. And if there's any questions today that I can't answer, I'll get with Nicole tomorrow and send out those responses. But in Seneca County, we actually have 2 projects directly addressing harm reduction, but neither project is contracted or funded through our board. One is funded by our health department, who has a grant, and they're a member of our opiate task force. But we try to stay connected to them to either promote their events or to gain access to their data and to just have an awareness of what is happening in Seneca County. So if you go to the next slide, the first project we actually found out through a resident of one of our female recovery houses in our board district. She was given a Narcan kit from someone when she was out in the community, and we did some investigation and learned that it was actually from the Harm Reduction Ohio project. If you go to the next page, this is actually information from their website. They're providing free Narcan to people who use drugs that be in contact with fentanyl and or people in frequent contact with people at risk of an overdose. They offer 2 types of the Narcan. They either do the nasal or the syringe option, which again, if you go on to the next slide, this is from their website. At first, we think they only had the syringe option, and I think that kind of came to a surprise to some people in our community. I don't know that they felt ready to see the syringes being distributed, and we understand now that they have the Narcan nasal spray available as an option. But if you look at the next slide, that's the kit that they were distributing that included the Narcan and the syringe. So I outreached to Harm Reduction Ohio and found out they actually have 4 strategies, which are listed on the next slide. In Seneca County, they're only doing the direct outreach at the street level. So they have a coordinator that I met with in our area that she'll go out wherever she thinks it's needed and she'll distribute the Narcan. And then they have a mail order option. So I outreached them to also find out their data. And what they told us is that the local distributor or outreach coordinator received the 30 IM kits in October, and then 30 Narcan nasal sprays and 10 more of the IM kits via mail, and that she's in the process of distributing these kits, and that there have also been 3 people who received a total of 4 Narcan boxes in November. But I really couldn't get a good sense of like how they do any type of education. When I asked the local distributor, she really did not indicate that there was much of any training. It was just more of giving the Narcan out and encouraging, people to have it available and use it. Now, when I asked via email to the people in Columbus who are behind this project, I didn't get any response when I asked that direct question. If you go on to the next slide, the other project is one that we're more familiar with as members of our coalition, and we're more involved with them. They have the Integrated Naloxone Access and Infrastructure Grant through Ohio Department of Health. And the Seneca County Health Department actually receives the grant, and they are partnering with Oriana House, which is a local treatment agency, and then Factor, which is a local peer support group for the project. The project staff have provided Narcan kits and education in the group and in individual settings. And we just feel more aware and comfortable with this project, again, because of the partnership, but also because we know they're doing education. And that education can vary, but we know they have a video, they do more one-on-one, and they have a handout when it comes to the education. They hosted one community training because this grant started back in October, and they have 2 additional trainings that are being planned in April and one in May. And they're expected to distribute 500 kits by the end of the grant period. So what they realized after they did their first training in November is they had, you know, a decent turnout. I think they had right around 20 people who came and got a Narcan kit, but they felt that they needed to increase their advertisement of the event because that was held in Tiffin, and it really could have reached anybody in our county, or actually anybody that would have been eligible. But I like the ideas that were shared today, and I'm going to encourage this group that they go where the people are already at. And I know for one of the events that's coming up next week that they already had scheduled, I know that they're trying to go to an event at a school that there's already somebody there that's going to talk about the loss of a loved one. So I do think in some sense they have that idea in mind, but I'm really going to encourage them because I too am concerned about the stigma here and that people might not come out just for an event that is centered around Narcan. The other thing I will add, because it feels like this isn't a whole lot of Narcan distribution, I think we were a lot like Sandusky County, and our community readiness, I think impacts kind of where we're at with Narcan distribution. It feels like we should be further along and have more going on in our community. And I do know our EMS is carrying it, but I think we were a little delayed in our readiness to have that in Seneca County.
So Robin, I'm curious, how did you hear about the Harm Reduction Ohio and decide to pursue reaching out with them and trying to make that connection? So I know you mentioned someone in your community brought them to your attention, but what sort of led you to reach out to them and kind of figure out what's going on here?
Well, actually, we own and operate the recovery house. And so here in Tiffin, and so when one of the residents came back from one of her events, she was a little concerned, and then so she gave her kit to the house manager, who is, you know, a person in recovery, and she knew there was a syringe in there. So I think there was a bit of a panic response from them, and oh no, what do we do? And so they called me, and then, you know, certainly I wanted to know more about this, who was doing it, and this is what we learned. But prior to that, they had not outreached to us to partner for the Narcan or be involved in any way. I do know that they plan on, in the coming month or so, they're going to do a first aid CPR training with our local Red Cross. And as part of that training, they hope to do they did say some education on the Narcan and give out some kits during that training.
Thank you. You also answered my next question was, you know, have they reached out to anybody in your community to partner as well? So I guess I'll just open up to the group. How many of you were aware of the Harm Reduction Ohio initiative, and are any of you all connected to it? I see Fairfield is a no. Sandusky, is that a no from you all?
We were aware of it, but we really haven't dived into it too deep. And it might have been, I think Robin was the one who informed me about it.
So this is Hillis in Washington County. I actually had a meeting with the health commissioner for the city of Marietta and Belpre health departments, and they actually referenced Harm Reduction Ohio and having reached out to them and some of the programs and resources available, and they were really applauding the agency and the assistance that they had received.
Thank you, Hillis. Ashtabula, what about you all up in your neck of the woods?
This is Miriam. Yeah, I think I think we saw something, but we haven't really seen anything like there's anybody doing anything here in Ashtabula County. I think I heard something about it at a meeting, but as far as we know, they're not doing anything here in Ashtabula County.